Editor-in-Chief live with Duncan, Garner.
It is budget week and our economy is tanking, and more than ever people are feeling the pressure. It can lead to all sorts of issues. And as always, mental health services are stretched beyond belief. It's always the case, isn't it? Well, 24 million for Gumboot Friday has already been announced. It offers 2 counselling sessions for 5 to 25-year-olds as a bridge into mental health services. It doesn't solve an enduring crisis in services for people with moderate to severe mental illness. Experts in the field are calling out for more money to be put aside to train and employ more mental health workers. We need a workforce, you see. Senior lecturer in psychological medicine at Auckland Uni is Dr. Hiran Thabrew, and he joins me now. G'day, good morning, nice to see you.
Morning, Duncan. Thanks for having me.
Yeah, no, you're welcome. So, if I was to turn up and need mental health care, say I just had my 2 counselling sessions and it still wasn't well, what would I get? Where would I go?
Well, there's a range of specialist mental health services, like for adults and young people as well. But there's also kind of a primary mental health services that were certainly started through the Access and Choice scheme by the last government. And it's been great. I mean, I think it's been great to see that investment in primary care. We certainly needed it for lots of people with mild to moderate mental health issues. But the services that have been there for a long time, the specialist mental health services, were designed for the top 3% of the population. And we know that now demand is much greater than that.
So do we have enough staff in the field? If we go into that middle area, are there staff there?
So workforce is the biggest problem, I think, across the whole mental health service, whether it's in the community or kind of in specialist mental health services. We know that we've had certainly an exodus of people in the last few years for a number of reasons. We're about 20% short of psychiatrists, for instance. We've been short of psychologists for a long time because we haven't trained enough of either. Having lowest numbers of these kind of specialists amongst most countries.
I read a report a couple of years ago that said we were 147 psychiatrists or psychologists short in New Zealand today. 147 that they were trying to employ, and they couldn't find them.
That's right. And the thing is, we haven't invested in training, I think. I mean, recently there's been an increase in the number of psychologists being trained, which is fantastic. And the incoming government did commit to increasing the number of psychiatrists as well, particularly Māori and Pacifica psychiatrists that we need more of.
So where's that? I mean, I remember covering the budget when the Labour government put in $1.9 billion into mental health, extra $1.9 billion, and then everyone was going, hoopla, it's all solved. Where's the money gone?
Yeah, well, that's a very good question. I mean, we think it went into primary mental health care services, and are they delivering? Who knows? We certainly haven't seen any published results.
Well, hang on a second. So this is a few years since then. 1.9 billion has it been spent? Well, like when you say who knows where it's gone, if anyone would know, would you know, or who would know?
I think a number of journalists have tried to answer this question over the last few years and not actually got a straight answer from the government about this. We know that a lot of it went into primary mental health care to set up those access and choice services and to employ staff. What it didn't do was necessarily increase the workforce, because the workforce for these new services had to come from somewhere, and a lot of them came from existing mental health services.
So how many workers short are we, do you think? How many mental health workers short are we in the area?
Well, we know that certainly attrition or people leaving the mental health workforce was about 12% in 2022, and recruitment was about 9%. So there was a deficit of 3%.
So what's that? We're dozens short? We're hundreds short? What would it be?
We're thousands short.
Thousands of workers short?
Yes.
In the mental health space?
Overall, if you include psychologists, psychiatrists, nurses, and other mental health specialists.
So despite a record spend, we're still thousands of people short. Where do we get them from? Because it takes time to train, doesn't it?
It does take time to train, and I think we need to invest in that training, because the people that we train here are the ones who are likely to stay here. But in the short term, I think we also need to recruit from overseas very actively.
And are we though?
Well, there is some recruitment going on through Te Whatuora, from my understanding, but we're competing with Australia, we're competing with other countries at the moment who are all looking for staff.
Does this threaten people's care? Does this threaten outcomes for people if we don't have the right people there? I mean, what are they going to... If there's no one there to look after them, who's looking after them?
Absolutely. I mean, I know you've been talking about mental health problems for a long while on your programs, Duncan, so you're aware about some of these issues. But what we have is a cycle of crisis-driven care where people are admitted later than they should be, they come in more unwell, they stay unwell for longer. And the people working in those services feel like they can't do a good enough job. So there's a sense of moral injury that also leads to burnout. So
what should we look for then in the budget on Thursday? If this is to be solved, what do we look for?
Well, I'm really hoping, if Nicola Willis's statement about frontline staff is true, that they will invest in frontline staff. So I think certainly investing in more training of specialist mental health staff and the work mental health folks, broadly speaking, so that there are enough people to fill the need in both specialist and community-based mental health services, as well as spending the ring fence, all of the money they've committed to mental health, and keeping the ring fence for mental health, But lastly, I think we need to update our mental health survey that's 20 years old. It's well and truly out of date, and all the current services were commissioned on the basis of that. It's time to do a new survey.
If someone presents themselves as suicidal, say to a hospital, and I know a number of years ago this was an issue because they were largely, but there were stories that they were sent home. There wasn't anything for them there. If I'm suicidal, what's there for me?
Yeah, I mean, I'm on call as a doctor like every few weeks, and certainly I work with young people, and every night I'm on call, I know there might be 1 or 2 beds left in the inpatient ward that I'm kind of covering.
Is that right?
So I have to make decisions about, who we send home, who we kind of admit to hospital. Now, I know certainly not everyone who's suicidal needs to be admitted to hospital. A lot of people just need increased support with their whānau in the community, and we usually will kind of establish that. But for those who do need some inpatient care and some respite, I think most of us working on the ground know there are deficits, and every night we're on call, we end up trying to bargain with whether we can send them home, whether we should keep them in the hospital, whether we should admit them to a mental health unit, based on whether they have beds or not.
That is a tough call for you. I mean, you're making potentially a life and death call based on the number of beds you have and the people in the waiting room who are presented in a poor state.
And that's the reality of our situation. But I mean, everyone working in mental health works there because works in mental health because we're passionate about it. So we all want to be there. We all want to do a good job. And we'll keep advocating for better services for the people we look after.
And
as well.
good on you too. Do you send people home that you wish you had a space for and you worry about that? Are we so stretched that you have to send people home that you wish would stay?
Sometimes that's the case, yeah.
And how often?
More often than I'd like to admit.
Right, okay. So their lives are at risk because we simply don't have the resource.
Well, I think when we send people home, again, if there's viable community supports that can, in their family or in respite houses, they're suitable alternatives. Not everyone needs to be in an inpatient unit.
Over the years, I've received a number of emails from different parents of 13, 15-year-olds, where they fall through the gaps, that they can't find services for them. Has that improved?
To a certain extent, yes. I guess in terms of there being more access through primary care for some support for these young people. And I think for people who might have mental distress and need some brief support, there are more options available. And I think even funding Mike King's charity is great in that respect. But I think for those with more kind of significant or enduring issues, and certainly more life-threatening issues, no.
That money from Mike King, 24 million over 4 years, significant. He really makes a difference, doesn't he?
Yeah, I mean, he's a good guy trying to do a good job, and I really respect him for that. So I have no problem with the investment into, his charity to support young people, because I think we need as much support for them as possible.
I'm always astonished that Mike King can find counsellors for people, but the government can't.
Well, I do wonder where he's going to get them. That is my only worry with that, is where are the counsellors going to come from, because I don't see lots of new counsellors being trained anywhere in this country.
No, so we should look for that in the budget on Thursday, that money set aside to train people.
Well, and that's my point about workforce. It's not just for specialist mental health services, it's across the board, because otherwise you're robbing Peter to pay Paul. Yeah.
Are you hopeful, though? This is the government that has demanded 7.5% cuts right across the public sector, and hundreds and hundreds and hundreds of jobs at each department are going. Are you hopeful?
I'm cautiously optimistic, mostly because this is the first government that's also invested in a mental health minister.
Yes, so but that could be window dressing, couldn't it? You have the minister, but you don't have the services.
Quite. Time will tell.
Yeah, well, hey, I appreciate your time this morning. Thank you so much.
You're more than welcome.